How have you been lately?
I've been hanging in there, but I have just been feeling down lately.
Why, what's wrong?
I have been dealing with depression a lot recently.
Why, what do you mean?
Well, I started to have seizures lately and I never had seizures before.
So you haven't been diagnosed with epilepsy, then why are you having seizures?
I don't know. I have to go to the hospital for a video electroencephalography test.
What's a video electroencephalography test?
A video electroencephalography test is when someone gets admitted into the hospital for seizure evaluation. VEEG monitoring is performed in the hospital with the goal of more clearly defining the type or types of seizures a patient is having.
How long do you have to stay in the hospital for this test?
Depends on what your doctor decides, but someone normally stays in the hospital between 4 and 7 days.
Are you scared about this test?
Actually, I am scared because I never had this test before, but my doctor explained to me that the test doesn't cause pain and it's where a camera is focused on my bed and the entire hospital room.
So how did your stay in the hospital go?
Well, when I first arrived at Tampa General Hospital, I checked in with my wife. When we first arrived, we got free valet parking because I was inpatient.
That's cool.
Let's head up into my place and be more privately.
Okay.
First, I had to fill out paperwork before I could head to my hospital room.
Wow.
When a nurse came down to pick us up and we headed to my private room.
What, you got a private room?
Yay, only because I was having a VEEG test done and I was giving a cute little blanket that was the only one I was allowed to use during my stay there.
Why weren't you allowed to use a regular hospital blanket and only use the baby blanket?
During my stay, I had a bunch of wires hooked up all over my head to monitor my brain waves. They were checking to see if I would have any abnormal electrical activity in my brain that causes the seizures, but I was only allowed the baby blanket because they had to be able to see my legs.
Why did they have to see your legs?
Seizures cause our muscles to tighten, become weaker, they could jerk or twitch. So in order to be able to tell what types of seizures a patient is experiencing, they must be able to see their legs and arms and basically the entire body.
You had to have been cold at some point because hospitals are normally freezing cold to kill germs and bacteria.
The setup is different nowadays because if I or my wife were cold or hot, they would have changed the temperature, but it only affected my room and nobody else.
Well, at least you both had the choice in temperature in your room.
Sometimes though, with my seizures, I become so hot to the point where I start to drip in sweat, which is another reason why I wasn't allowed long and thick blankets. And yes, my wife was allowed a big thick blanket if she wanted one, since she's not the one who's getting the test done.
I figured that. So what else happened during your stay?
There was a thick and blue padded mat on the floor on both sides of my bed.
Why was there a mat on both sides of your bed on the ground for?
In case I had a seizure and I either fell out of bed or I'm walking around the room and I fell, I wouldn't hurt myself. Let me be more clear about what I'm talking about, because the mat spread farther out and away from the bed because I was allowed to walk around the room, but unfortunately there's not a mat in the bathroom. If I were starting to feel bad or off and if I was able to, I was supposed to push the button on my remote for medical assistance.
Feelings? What feelings?
My seizure auras.
Oh, okay.
Like, I can't always explain the way I feel with my seizures because it's just impossible to do.
Please explain to me how you can have feelings but not able to describe how you are feeling with the auras.
Well, I can sometimes describe the way I feel, but as soon as a seizure is approaching, I'm unable to describe the way I feel, and I can't tell you how I feel because I can't even understand how I feel. It's just a strange and uncomfortable sensation throughout my entire body that I unfortunately, as well as other people with seizures, can't do. I just don't know, Alex. It's fine, I'm heading to my neurologist right now and I'm heading to the bus stop, and you can come if you want to because I don't mind.
Yes, I'll come with you.
Okay, let's go. My neurologist is great.
What exactly are we going to see him for again?
Results from when I went to the hospital for the versus EEG study.
Oh yeah.